Good day everyone, my name is Chris Daniel Sumawang, a student nurse from Tarlac State University from BSN 1B, and for today I will be performing the evaluation checklist on the assessment of the patient's integumentary system such as the skin, the hair, the scalp, and the nails. So for our following the nursing process, we will now proceed to our preparation. So first thing that we need to do is we need to introduce ourselves to our patient and verify the patient's identity. Next is to explain to the client what we are going to do and why is it necessary and how the client can cooperate with our procedure. So hi ma'am, my name is Chris. I am a student nurse from Tarlac State University. May I know your name po?
I'm Sheena.
Okay, ma'am Sheena, pwede ko po bang tingnan yung wristband nyo? Thank you po. So ma'am, today I will be assessing the integumentary of sa inyo po. Okay lang po ba?
Yes.
Okay, thank you po. And now, for our second step, we will perform hand hygiene and observe other appropriate infection control procedures. And for our next step, we will be assembling our equipment and supplies. So for our equipment, we do need to have a millimeter ruler, an examination glove, and a magnifying glass. So for our fourth step, we need to provide some privacy for our patient and by closing the curtains around bed or closing the doors to room if possible. And now we will proceed to the assessment of the patient's skin. So first thing that we need to assess, we need to determine the client's history of the following. First is the patient's if he or she is experiencing pain or itching, presence and spread of any lesions, bruises, abrasions, or pigmented spots. If there are previous experience with skin problems, and if there are related systemic conditions. Next is if he or she is using medications such as lotions and home remedies, and we will assess whether the patient has an excessively dry or moist skin. Next is the tendency to bruise easily, and we will assess for any association of the problem to season of the year. Okay ma'am, nakararanas po ba kayo ngayon ng mga pangangati or pananakit po sa inyong pong balat?
Wala po.
Okay po. So, next po, meron po ba kayong mga nararamdaman na kapag nag-bruise po ba kayo easily?
Hindi rin po.
Okay po. Kapag malamig po ba or mainit, may nangyayari po ba sa skin nyo?
Wala naman.
Gumagamit po ba kayo ng any medications or lotions or home remedies?
Moisturizer lang.
Okay po. So now we will proceed to the assessment for the skin color as well as the uniformity of the skin color of the patient. So ma'am, okay lang po ba? Tingnan ko po yung balat.
Opo.
Okay po. Okay lang po, itaas ko po yung sleeves.
Opo.
Okay, thank you po. Yung isa po. Thank you po ma'am. So, as I have inspected, the patient has an fair skin, and also the uniformity of the patient's skin is even. So for our next step, we need to inspect and palpate and describe the skin lesions, and we need to apply gloves if the lesions are open and draining. So as I have expected earlier, the patient has no lesions on the skin, so applying gloves is not necessary right now. So next, for our next step is we need to palpate the lesions to determine the shape and textures. So as I have said, the patient has no lesions, and step 9 is not necessary. So for our 10th step, we need to observe and palpate the skin moisture. So ma'am, dali ko ba bang ilamin ang inyong kamay? So po. Okay, thank you po. So for our next step, we need to palpate the skin temperature of the patient and compare the 2 feet and the 2 hands using the back of our fingers. Ma'am, hiramin ko po ulit ang inyong kamay. Pwede ko po bang yung paa? Okay, isa po. Thank you po. And for our next step, we need to assess for any assess the edema if present, location, color, temperature, and shape, and the degree to which the skin remains indented or pinted or pressed by the finger. So, kakasabi ko kanina, wala mang lesions or any edemas in the skin of our patient. So for our 13th step, we need to note the skin turgor for fullness and elasticity by lifting and pinching the skin on an extremity. So ma'am, pwede po bang hiramin yung kamay nyo? Isa po. Thank you po. Next is we need to remove and discharge gloves and perform hand hygiene. And now we will proceed to the assessment of the patient's hair and scalp. So first thing that we need to do is we need to determine the client's history of the following. Kung recently, kulay ba siya ng kanyang buhok, and nag-curl ba siya ng kanyang buhok, or nagpa-rebond. So ma'am, recently po ba nagpakulay ko yung buhok?
Hindi po.
Nagpakulot po?
Hindi rin po.
Nagpa-rebond po?
Hindi rin po.
Okay po. So ma'am, nag-chemotherapy po ba kayo?
Hindi po.
Okay, thank you po. And now we will proceed to our assessment. We need to inspect the evenness of growth over the scalp. Also, we need to inspect the hair, thickness, and the skin. Also, we need to inspect the texture and the oilness of the hair. Ma'am, i-assess ko po ang inyong hair. Okay lang po?
Opo.
Okay, thank you po. For our fourth step, we need to inspect the scalp for lesions and hair and scalp for presence of any lice or nits. So as I have inspected earlier, there are no lice or any nits present in the patient's scalp. So for our fifth step, we need to note the presence of infections or infestations by parting the hairs in several areas of and checking behind the ears and along the hairline and at the neck. Ma'am, assess ko po ulit. Okay, thank you po. And for our sixth step, we need to inspect amount of body hair. And for our seventh step, we need to document our findings in the client's record. So ma'am, pwede po bang check? Pwede ko po bang taas ulit? Sa po? Sa paa po? Okay, thank you po. Next is we will be assessing the patient's nails. First thing that we need to do is we need to determine the client's history of the following. First is if he or she experienced already diabetes, mellitus, and peripheral circulatory disease, previous injury, or severe illness. So ma'am, nakararanas na po ba kayo ng mga diabetes?
Hindi po.
Any family history po ng diabetes?
Wala po.
Okay po. So, nagkaroon na po ba kayo ng mga peripheral circulatory disease?
Wala naman.
Okay po. Previously po ba nagkaroon kayo ng mga injuries?
Wala din.
Okay po. And mga severe illness po, like ng sobrang pag-init po ng katawan?
Wala din.
Okay po. And now we will proceed to the assessment. First, we need to inspect the fingernails of the patient, plate shape, to determine its curvature and angle. So ma'am, gawin po natin to. Okay, din po. Okay po. Salamat po. So, as I have inspected, yung nails ng ating patient, fingernails ng ating patient ay convex and nasa 160 degrees. Next is we need to inspect the fingernails and toenails for texture, and we need to inspect the fingernails and toenails, bed color, and tissue surrounding the nails. Ma'am, pwede po bang tingnan yung nails nyo? Okay po, sa paa po. Okay, thank you po. Next is we need to palpate the fingernails and toenails. Ma'am? Opo. Okay po. After that, we will be performing a blanch test of the capillary refill. We need to press 2 or more nails between the thumb and index finger, and we need to look for blanching and return pink of the nail bed. So, ang gagawin lang natin dito is ipipinch lang natin yung nails ng ating patient and titingnan natin kung mag-turn ng white and kung babalik ng pink. Ma'am? Kabila po. Okay. For our evaluation, we need to perform a detailed follow-up examination on the other individual system based on findings that deviated from expected or normal for the client. We also need to relate findings to previous assessment data if available. And that would be all for the assessment of the integumentary system of our client. That would be all. Thank you.